Hi, my name is Lisa Luna, and I will be presenting my risk assessment project. The agenda for today is I will be talking about the medical assessment, periodontal assessment, treatment plan, and treatment progress of the patient, oral hygiene, plaque control record, nutritional counseling, dental caries, and acid production, as well as research from articles, and an interesting experience during the project. Okay, so for the medical assessment, the patient is an 18-year-old Hispanic male. The patient does not smoke or have any systemic conditions. The patient has a family history of hypertension, diabetes, and sleep apnea. His baseline vitals are blood pressure is 112/78, his pulse was 56, his respiratory was 16, his temperature was 96.3, and his oxygen level was 95%. He has a healthy BMI of 23, and according to his blood pressure and his BMI, he is classified as ASA1. Although the patient did state he had a fracture on his scaphoid bone on his right thumb and his right proximal phalanges of his right pinky, he did say that he does not have any problems brushing or flossing with his right hand. Patient presented with no recession, frication, or mobility, although patient does present with a generalized pocket depth of 2 to 3 millimeters and localized pocket depth of 4 millimeters on teeth numbers 3, 5, 15, 18, 29, 30, and 31. He also presented with generalized, well-defined, healthy alveolar crest with localized active bone loss that shows fuzziness interproximal of tooths number 12 and 13, 18 and 19, 30 and 31, but this does not measure beyond the 2 millimeters. Patient also presented with a radiographic evidence that shows crown to root ratio of 1 to 2, and after full mouth assessment, patient was categorized as gingivitis dental biofilm induced. Upon his intraoral assessment, he presented with bilateral linea alba, an open bite on tooth number 7 and 10, and an asymptomatic white keratinized tissue located on the left buccal, measuring 3 millimeters by 2 millimeters, possibly due to trauma on his open bite. And he also presented with exostosis measuring 2 millimeters by 2 millimeters on the maxillary attached gingiva of tooth number 12. Upon palpation, papule is firm to touch with no pain. Patient also presented with the radiographic lesion within the pulp chamber of tooth number 28, measuring 3 millimeters by 2 millimeters with a well-defined border. As for his treatment plan, a 1 appointment will be required to do his prophylaxis. This will be followed by a re-evaluation appointment in 4 to 6 weeks. After that, we will see the patient every 3 months due to his 3 local factors of many interproximal decay, impacted third molars, and a high PC score of 72%. As for the treatment progress, after a FUMA pan scale, polish, and fluoride, at the re-evaluation appointment, patient presented with recurrent localized gingivitis on tooth number 7. Tooth number 7 showed red, soft, round, and shiny appearance on the free gingiva. Some residual calculus was left over on tooth number 26. As for the plaque control record, pre-treatment, the patient presented with 72%. Post-treatment, the patient presented with 20%. As for the oral hygiene instructions, the patient was instructed to brush and floss twice daily and use fluoridated products such as Sensodyne toothpaste and Act mouthwash. Patient was also instructed to use a C-shaped flossing technique using a flat tape floss. As for nutritional counseling, the patient stated he wanted to gain more muscle mass. It was recommended for him to eat more healthy protein such as lean meats of fish, salmon, steak, and healthy carbohydrates such as grains, brown rice, and cauliflower. In addition, upon his first 3-day analysis, patient consumed too much processed carbohydrates. In response, patient was recommended to cook his own meals. The patient took the initiative and made his very first healthy 3-course meal of baked salmon, natural brown rice, and a fully loaded mashed cauliflower. The patient did present with quite a few dental caries. On the right side, he had dental caries on tooths number 3 and 4, 29, 30, and 31. On the left side, he had dental caries on tooths number 12, 13, 14, 18, and 19. The patient was educated on the correlation between sugar, starches, bacteria producing acid leading to dental caries. As for prognosis, considering the patient's compliance, easy maintenance, adequate periodontal support, the patient's prognosis is good. Patient was very interactive and asked a lot of questions. Patient does not present with malocclusion, therefore has easy maintenance of oral hygiene care. Although patient does present with many incipient interproximal decay that can affect the periodontal support in the future, patient was very compliant with nutritional recommendation and at-home oral hygiene care. After further nutritional research, considering the patient's young adolescence age, the patient consumed much processed foods and fermentable carbohydrates. According to the article Consumption of Ultra-Processed Foods and its Association with Added Sugar Content in the Diets of U.S. Children, states ultra-processed foods contributed to 65% of total energy intake and to 92% of energy from added sugars in the diet of U.S. children. In another article, according to Integrated Hypothesis of Dental Caries and Periodontal Disease, this article states excessive intake of fermentable carbohydrates may contribute to inflammation in periodontal tissues resulting from hypoglycemia. It also states that dental hard tissues and caries and inflammation in gingivitis and periodontitis, both diseases originate in the dynamic stability stage and emerge in response to nutritional imbalances in the microbiota. The most interesting experience during the project was the recurrent localized gingivitis the patient presented upon the reevaluation appointment on tooth number 7. After further research, it was noted that the patient had experienced some trauma in that localized area while playing football. The patient was recommended to get a customized sports guard to protect his teeth from further damage. Here is my reference page. Thank you and have a great day.